leaky gut, hyperpermeability, and dairy and excess. Talk about food sensitivities. How does that relate? Well, how should parents think about this, especially as it relates, by the way, to immune dysfunction, eczema, atopic dermatitis?
Yeah, we talk about that all the time. So what it is that when we were already alluding to stress during pregnancy, because when does eczema, so we'll use eczema as an example, because eczema happens, most common time to diagnose eczema is between 3 and 6 months of age. And number one question to parents, well, how can they have a chronic disease when they were just born? They didn't do anything. I'm like, but we have pregnancy and we have what you did before. And so let's take into account, we talked about stress, we talked omega-3s, we talked about fluoride, several other toxins, the maternal nutrition, paternal nutrition, all the things. So what happens when the baby comes out, instead of the gut cells being all lined up in our gut, our intestine is made up of wall of cells, and they're all tight together, and the body gets dairy in and from mom's milk or from formula, let's say, and the body is used to breaking it down, amino acids, vitamin D, into fats, into all the different globules, and then it diffuses through the cells. But when you have leaky gut and the cells are open, there's a gap between the cells because of stress, because of hormones, because of yeast, because of toxins like we talked about. Now when we're exposed to dairy, a chunk of dairy goes in between the cells. So it's not so the body doesn't have to fully digest it. Now it just goes between the cells.
Straight into the bloodstream.
Straight into the bloodstream. And the immune system does not know dairy protein. It knows amino acids, it knows fat globules, it knows the vitamins. It doesn't know a chunk of dairy. So now we make an antibody to the dairy. And then when you make an antibody to the dairy, now this immune system is on hyper alert. Wait, what else can happen? But we have whole. So now here comes gluten, here comes egg, here comes peanuts. One after the other, they slowly come through. And in the traditional world, it's like, oh, you have food allergies. Nothing we can do. I mean, OIT and other things, but I mean, oh, too bad. Rather than, wait. One food allergen is going to be accompanied by another food allergen. And even more importantly, which is not recognized, food sensitivities. Because when the food sensitivities come in, those are like tiny little annoying little pests. And they don't pop up on a traditional panel, blood, or skin test. And people don't realize that that's also adding to the whole problem. So your food allergy test is negative for dairy, so you're like, hey, whatever. But you have all these sensitivities brewing in there because you don't know that we're dealing with leaky gut. So when we have eczema, for example, your child has leaky gut. People always go after the lotion, but we know eczema is not a lotion deficiency. Eczema is a visual representation of what the gut looks like on the inside.
So what you're talking about, and this is a great word for people, root cause.
Yeah.
You're looking for the root cause, the origin, not the symptom.
Yes.
Yeah.
And speaking of origin, I mean, if you go way back to development, in the first trimester, the gut and the skin, what we see anyways, is basically coming from the same cell divide. Like your skin is external gut, or vice versa. Your gut's like internal skin. And so well said. So by the way, just real quick, where can parents that suspect their child's eczema, which is, as you mentioned, most of the time, at least relevant in part to food sensitivities, not just allergies, can they get tested? What kind of pediatrician should they be looking to have this level of acknowledgement, to look into this in this way?
Yeah, so food testing and allergy testing for foods in the first couple of years of life is not very accurate.
Right.
It could actually lead to a lot of food phobia, food fear, and orthorexia. I have a lot of moms that come see me and they're basically eating lettuce because they're so afraid of everything. You can't heal if you're just eating lettuce. So my best tip, do not DIY this. You need to find a functional medicine pediatrician, integrative doctor, functional medicine, nutritionist, coach, naturopathic doctor, nurse practitioner. We need a provider that knows how to do this because we get in trouble real quick when we're trying to do the guessing game, because not all when it comes to eczema is a roller coaster. It is the most hideous roller coaster. And you're like, you flare now, you don't flare. You flare, you don't flare. And parents will associate a food with a flare when in fact the eczema is going to flare regardless. So you really need somebody who knows how to do this and help calm the nervous system, because back to the anxiety, it all starts in a vortex. And then the root cause for eczema or any chronic disease is never one thing. It's never your stress. It's never the genetics like we already talked about. It's never the fluoride. It's when you put all those together, the human body is a cup of inflammation. And when the cup is filled with all the things we've mentioned already, it overflows. And in some people, it shows up in their skin, some people in their brain as ADHD, and some people in their lungs as asthma.
So everybody has a threshold.
Everybody has a threshold, and my threshold is not the same as yours. So a lot of parents will look and go, oh, well, my child can do red 40, for example, but they have no ADHD symptoms. Therefore, any studies that I come across is BS because that's not happening in my house. Also, my child reacts to red 40 and he loses his mind. Therefore, all children are. So we have this way of trying to, it's a cognitive bias because each human is different and each human's cup of inflammation is very different and how they respond to that is different.
And I think a lot of that is born from or onto us through genetics. We talked about how genetics only account for 20, 30 or so percent, depending on the studies you read. But I guess my point in this case is that there are a slew of genetics that predispose us one way or the other with respect to what are called human leukocyte antibodies, right? More predisposed to gluten intolerance or not. And by the way, to your earlier point around endothelial dysfunction or how quickly one might succumb to thickening of the arteries early on. I mean, pre-teen years, for example, is related to single gene, by the way. Most things aren't. But that the functional genomics, at least, genetic experts of this world associate as the heart of the human genome. It's called 9p21. But having multiple, let's call them suboptimal variations of that single gene on different locations predisposes you to endothelial dysfunction. So that's when you have to be worried early on. By the way, your kids can be tested very early for genetic susceptibilities when you're under the care of the right practitioner. I didn't want to miss this, though, because you said this. And you can go to the Institute for Functional Medicine, find a functional medicine practitioner, a pediatrician, a dermatologist, a GP who's had this further education. By using your zip code or postal code.
I use that link all the time.
And just before we move on from the leaky gut, what testing do you do that's very easy at home that can take a look at that?
Oh, for leaky gut for children?
Yeah.
I don't.
No?
I don't do testing. I'm a low test kind of a doctor. They're not very accurate in the beginning, and I've done a lot of tests as older children. Just the babies' poop studies are usually very difficult. But I do for food. I do a gold standard. The gold standard is you replace the food. So for dairy, we never eliminate. We always replace. So we take dairy out and replace it with an equally nutritious food for a minimum of 30 days. And then we bring it back and see if the body's responds to whatever the issue is. Same thing for gluten. Processed foods, all right, we get rid of processed foods. And so we'll do, dietary modification. The gold standard for any dietary modifications is oral challenge. So we work with that I say to people, I'm like, if you're not pooping every day, your gut's not working. I mean, I can do a fancy test, but your gut's not working. And what other? And when your child is experiencing eczema, ADHD. Now, again, ADHD is going to be older, so I can do poop tests. In younger kids, it's just not that accurate. And we know we have dysbiosis. We know we need to rebalance it. So yeah, that's.
So just generally, from what age would you do the stool test?
2 years and up.
Okay.